So exactly 1 week ago today, I had a lipoma removed off of my clavicle here. So I still have the steri strips on, still have a little bit of swelling. So I just wanted to go ahead and talk to you a little bit about how this past week has been, how the recovery is doing, how just this whole area in general is doing, as well as, you know, my function and being able to use the arm, because that's really what's important. I don't have a lot of restrictions like some of you may have that have had a, you know, more involved type of shoulder surgeries. Specifically for me, I'm just supposed to kind of take it easy, which honestly has been a little bit hard to do because I am a mother to 3 boys and working, and so that's been a little challenging. So I will have to say that I've probably overdone it a little bit. A couple of days I definitely could tell that I had a lot more swelling and a little bit more soreness. Now, to say I've had pain in this area, I would say probably not. Maybe just some overall discomfort. A good way to explain would be that I've been experiencing more tightness than anything. I think it's more of when I move in certain directions, I'll feel a little pulling in the incision because my body is going through a different phase of healing now, right? So, you know, those first like 3 to 5 days, our bodies typically are really good about trying to just heal that incision because it has sensed an opening in the skin and our body wants to protect it and not get any foreign bodies going into our body. So it does a really, really good job with closing the incision. Now, I haven't taken the steri strips off to see if my incision is completely closed, but it's not draining or seeping, and I haven't had to put any kind of gauze or anything like that on it for several days. So to me, that tells me that it is closed. Now, that doesn't mean that it's super strong though right now. So I still have to be careful and make sure that I'm not applying any kind of lotions or creams or anything like that right now. And so for now though, now that my body is kind of more in that second phase of healing where it's trying to now really do a good job with healing more on the inside. And that's kind of where that scar tissue starts, you know, forming more, and you might feel a little more of that tightness. That's kind of what I'm experiencing right now. Certain movements still can kind of bother me. I don't do a ton of overhead activities right now just because that kind of pulls on it. I have made sure that I'm moving my shoulder though and making sure that I am doing some gentle type of neck exercises because that's really where I feel a little bit of that pulling. So I don't want the scar tissue to get stuck right now, but I also want to make sure I'm not too aggressive with my movement and potentially pulling on that tissue too much as it's trying to heal. So I am making sure that I am icing the area a few times a day. That does seem to help with achiness, but it does seem to make it kind of stiff. You might notice that too, that, you know, you have a little bit of pain and the ice seems to help it, but yet it does kind of make you stiff. So I do have to make sure that I move a little bit after that ice just to kind of work through some of that stiffness. So far, so good. I have been able to sleep at night. I am making sure that I do have a pillow kind of just supporting my arm. That does help pull my arm out to the side a little bit, which helps take some of the pressure off of this scar. So propping my arm up with a small pillow has been helpful. I am a side sleeper and I do usually sleep on this side, which I don't do that yet. That does wake me up every time I try to roll over. So I have had a little bit of interrupted sleep, but overall it hasn't been too bad. I haven't had to take any kind of pain medications other than ice and just doing some simple range of motion exercises. That's really, it's really helped it be very manageable. Most of the activities that I do around the house, I'm, you know, cooking and cleaning and working. So a lot of those activities are more down in this range here. So that's very doable. I haven't really went to reach too high up into a cabinet and pick anything too heavy up. I still am going to be using my other arm just to do that, just to make sure that I don't strain things since I am just 7 days out. So I do have a follow-up appointment here with the surgeon in about another week. So typically it's around 10 to 14 days that you would follow up with the surgeon just for them to kind of take a look at everything. And if the steri strips haven't fallen off, then they'll probably take them off to take a look at the scar. If they do start falling off, I'm probably just going to kind of help peel them off, because I really want to see what it looks like underneath there too. Now, I have had a couple of challenges with keeping this dry when I'm showering. I did a really good job with the post-op dressing. They had a big Tegaderm film and gauze on my incision, which really helped seal that incision. I didn't get any kind of moisture at all in that with the first shower. So after 2 days, then I did change my incision and I put a smaller Tegaderm piece and a smaller piece of gauze. Now that didn't quite completely cover my incision, so I did use press and seal over the top of my shoulder, and that really helped seal in any kind of water and prevent any water from getting in there. So that did a great job the second time. Now, just the other day, I did take another shower and I had taken the Tegaderm off and I just used the press and seal. That did not do a very good job of sealing the moisture, and my incision got wet, which I know it's not supposed to be. So my incision got wet, steri strips got wet. So I just made sure afterwards that I dried everything really well, and I've just been keeping an eye on my skin just to make sure things don't get really macerated, because really that's one of the primary things you don't want to happen is that your incision gets very wet. So I wouldn't want to have wet steri strips and then put something on top of that to seal the moisture in. So I made sure I didn't cover the incision and the wet steri strips. I let everything air out, and it's been fine. Do clean the skin a little bit, especially if your skin's a little sweaty or oily, because I don't think the press and seal is going to stick very well, just from experience. And also, it is a little challenging for that press and seal to stick over bony areas like a clavicle and a shoulder. The press and seal seems to do a little better over areas like your hand or your arm, where you can actually like wrap around a couple of layers. Kind of hard to wrap around a couple layers up on the shoulder and the clavicle. So I may do another video just to kind of let you know after maybe 2 weeks, so I can show you what the scar looks like, and when I start getting into a little bit more of scar management and what to do for that. So do keep an eye out for that video. If you found this video helpful, do give it a like, and don't forget to hit that subscribe button below. Also, do make sure you check out these videos that YouTube is suggesting for you. Bye guys.